This is a video of an arthroscopic biceps tenodesis. There are many different ways to perform this procedure. This is just one example. The goal of the biceps procedure is to move the biceps outside the shoulder joint and fix it down the humerus bone so that it no longer causes pain with shoulder motion. The procedure begins with visualization with the arthroscope inside the shoulder joint. The structure being pushed here is the biceps tendon that comes up out of the arm and actually comes inside the shoulder joint. The next step of the procedure is to remove some of the tissue restraints around the biceps so it can be exposed. This view is now outside the shoulder joint and down the arm, further releasing the biceps. This view now shows the bony groove that the bicep runs up in as it enters the shoulder joint. This is where it will be repaired. An absorbable anchor is then placed along the groove to fixate the biceps. The anchor has sutures on it that will be passed around the biceps so that it can be repaired in the groove here. A special instrument is used to put the sutures through the biceps, and then they're then looped around the biceps to enhance the fixation. This will allow for better healing of the biceps within this groove. There are 3 sutures on the anchor that are passed sequentially. This is a second suture that's being put through the biceps, again with a loop that allows it to grasp the biceps so it heals appropriately. The third suture is then passed around the biceps as well to act as a compression stitch. One can now see all the sutures placed in the appropriate positions around the biceps. The sutures are then tied to fixate the biceps to the bone so it will heal. This is done with multiple knots. Once the knots have all been tied, the biceps is now well fixed against the bone. To complete the procedure, the arthroscope is placed back into the joint and the biceps is now released from its insertion inside the shoulder joint. Thank you for your attention.